Hi guys, and welcome back again to Health Focus with Amy. I'm so honored to have you all the time. Thank you for coming back again. If you're new to this channel, consider subscribing. This is where I keep on telling you we talk health matters, equipments, professions, careers, conditions, and every single thing you want to mention in healthcare. We left our visitor, our guest last time talking about critical care nursing, and today he has a lot of things to teach us. Come in with me and let's see what he has to offer. If you ever had a patient in ICU, you've walked in and you'll see all these pipes in an area. He'll try to bring us home in a very simple language. What happens when you come in with a certain condition, especially affecting the lungs? Welcome, Simon.
A condition of in the lungs is not just a condition in the lungs, it's a disease. And most of the times we call it pneumonia. Pneumonia, when it comes to pneumonia, is disease of the lungs. So it is affecting your lungs, cannot be able to breathe well. It means that there is something, an infection in your body. It might be viral from the viruses. It might be from bacteria.
COVID-19 virus.
COVID-19. It might be from TB. You might be able to get TB. It might be from other bacteria, streptococcus, especially in our skin, which are most of the time, which are in our skin. In our skin. To take you back for the listeners who are not doesn't know the lungs, we have two lungs. We have a tree. It's like a tree. It's like a tree whereby you find it's a tree called trachea, and then it is divided into two. Then when it is divided into two, inside the lungs we have small sacs which are called the alveolus, whereby they are the one which helps you to be able to get oxygen in and breathe out the carbon dioxide. We call the carbon dioxide. If there is a problem in your lungs, in the alveolus, one, you cannot be able to breathe well. Another reason you are going to start having those signs and symptoms. One of the key elements of the reflexes of the body, or the body mechanism, how it does, is that whenever you have a foreign body, you cough out. You try to cough out. So you are going to start coughing out because already you want to eradicate that, because it's the body is sensing there's an alien in your lung, so it tries to cough out. If it doesn't come out, the other immunity of the body, white blood cells, they are the soldiers of your body. Whereby they are going to fight. They are going to fight the enemies, and in that process, you know, like now we said the soldiers in Somalia, KDF, some of them they are going to be killed. Yeah. Some of them they are going to be killed. The same applies to white blood cells, the body. The white blood cells are going to be killed, and because of that, red blood cells are also going to be killed. And then because of that, if they are still not, an action is not taken, they form fluid. They form fluid in those small sacs, and you cannot be able to breathe. So you find that the oxygen in your body becomes less, and also you might be able to have a lot of carbon dioxide. So the body mechanism sometimes because of that, it also now thinks, because already I have some foreign body here, I need to increase my temperature to burn it. And that's the reason you see the patient comes into hospital with either cough, they are going to present with a cough.
To remove the foreign body.
To remove the foreign body, they are going to the temperature to kill. They are trying to kill because of the antibody reactions. Because already the police and the alien they are fighting. Because of that fight, they get the temperature. What are some of the signs and symptoms? Signs and symptoms.
The things the patient will say, I'm feeling or I'm having.
Yeah, the patient will come to the hospital with saying that I cannot be able to breathe well, I'm having chest pain,
I'm coughing, the
fever is high, I'm fatigued. If it is not affecting the system, maybe the blood system and whatever, they are going now to come with saying that they are fatigued. Confusion, some of them they are going to come with a confusion. Why? Because remember in the sac there is no oxygen. So these patients there is no oxygen in the brain. In medical term we call it hypoxia. You find that the patient comes with the hypoxia.
So because the oxygen is not going to the brain.
Not going to the brain. Yeah? And then you see other they are going to come hyperventilating, breathing fast. Hunger, they are
thirsty for air.
Yeah, they are thirsty for air. Because of that continuous hyperventilating or breathing fast, some of them they are going to come with dehydration.
Oh yeah.
They are going to come with dehydration.
Yeah.
So you need to be able to know the first measures to be able to do this to this patient. We have different categories of pneumonia. We have community. Community pneumonia is there. You are going to get an infection from the community. You are not in the hospital. In the hospital, you can also be able to get
pneumonia. You pick it.
Yes, you pick it in the hospital acquired infections. And sometimes for long-stay patient, you can also be able to get aspiration pneumonias. For those in ICU, you find so many patients getting ventilator-associated pneumonias because already you cannot, your reflexes have been interfered with. So for this patient, you can also be able to, when this patient comes, you need to be able to know, to be able to do simple tests, radiological imagings. You need to do chest X-rays. And then the simple things you are going to find is that you need to monitor the oxygen level for that patient. Yeah? In this pandemic, you have to be very careful because you might be doing any pneumonia. We are treating as a suspect.
The suspect of a viral.
Of a viral infection.
Let's people stop thinking that anybody having shortness of breath, this is COVID.
Yes.
Any shortness of breath is pneumonia that might be either viral or bacterial or fungal.
Yes, and that is why people, they need to be able to understand how to get COVID. COVID is contact.
It's contact.
So you find most of the patients, they might be neglected because of or might be stigmatized, and other communicable diseases overlooked. And this patient might die on you, thinking it is COVID, and the patient is only myocardial infarction. It's having myocardial infarction. So and then you say, this is COVID, this is COVID.
Or an asthmatic attack.
Yeah, on an asthmatic attack. All the patients are having other communicable diseases. Okay. So it's only the contact disease, and how do you prevent yourself? It's only a matter of proper heart hygiene, regular heart hygiene, following the WHO guidance.
So that you don't inhale the virus or the bacteria.
For the heart hygiene, it is because of the contact. Remember, it is contact. And then because you see COVID is droplet, you need to be able to have a mask. You need to have a mask always, especially when you are at the care facility. And also the community, we are saying the community, you need to have your mask always because you never know who is having. Some of the patients, they are symptomatic, others are asymptomatic. So you find for the COVID, we are able to categorize this in 3 parts. We have the moderate, mild, and severe. So for them, for the moderate, you might find the patient comes in the hospital, do the radiological imaging, you find this patient could be having mild COVID-19 pneumonia, and you refer the patient on home-based care for self-isolation.
I thought when somebody does you a chest X-ray, you can be able to interpret yourself, even if you're not a medic as much, because your lungs are supposed to be black.
Yes.
On the X-ray. When you look at it, they're supposed to be black. When you see white patches, there is water, that's water.
That is
that's a foreign thing in that lung.
It is a foreign thing in that lung. Then after that, you find that for you to be able to even confirm that the patient is having COVID, you need to do the chest X-ray. You can also be able to do HRCT, that is scan of the chest. You can also be able to do other blood workups, like you are going to find the CRP, the markers of infection are high. Other things like you call the medical term, the ferritin, you find they are high. The dimers, which is a sense of tells you about whether there's a clot. It's going to be high. Why are you going to get the D-dimers high? Because the COVID-19 you are going to find, it has high affinity of angiotensin converting enzyme. So to
a layman language, why will I have blood clots? Why am I in a risk, permanent risk?
You are at risk because of the factors or the things which need to make your blood not clot. They are already interfered with by COVID, the virus. So you find, because of that, all the patients are not going to come coughing. Others, they are going to come with diarrhea.
Blood clots,
others are going to come with stroke. Others might come with chest now problem, like what most of the people they are looking for. Before you realize the patient is having COVID-19, or if the patient is very sick.
So is somebody able to diagnose COVID-19 with a blood work only?
No, you have to be able to correlate the clinical, because sometimes what you do, sometimes you do the blood workups and then you find this patient could be having an infection. already you did your HRCT scan chest. Yes, it's a suggestive of COVID-19. So you need to be able to do the clinical judgment, you do the clinical workup, you do also the laboratory biochemistry investigations, laboratory workups, and then after that, for confirmatory measures, you do the oropharyngeal and nasopharyngeal swabs.
That one is confirmatory.
Confirmatory.
If you don't do it, you can't tell me I have COVID.
Yes. And it doesn't mean a negative result. Doesn't mean you are negative. You might be.
When all other parameters are.
Yes, you might be negative, but you still have clinical symptoms of COVID-19. So you have to be able to keep you and repeat the test after 24 hours.
So apart from COVID-19 virus bringing pneumonia symptoms,
yes,
there are so many other symptoms that it can affect other systems, like circulatory by bringing clots.
Yes.
Digestive by bringing diarrhea. It brings fevers and hypoxia to the brain that gets you confusion.
Yes.
So don't think everybody coughing is having COVID.
Yes, it's not everybody who is coughing is having COVID.
So you have a patient of extreme.
So when this patient comes, we need to be able to settle the patient on the bed. So when you come to the hospital, we are going to put something like this. It's oximeter. It assesses the oxygen in your blood. It is not painful, and then after that, it is going to be able to give us the saturations. I remember I had said saturation is between 90 to 100 to 100. If it is lower than that, we consider is hypoxia. As you can be able to see, my colleague here, her SpO2 is 98, which is super, and that is so good. Then after that, if the patient, you still continue monitoring the patient, and if you find the patient is desaturating or the oxygen level is low, the doctor, or what we do, put you on a face mask. These are some of the face masks, some of the instruments.
Tell them, for any accident, emergency, or critical care nursing, this thing is critical.
It's critical.
It's very critical. It's called a crash cut.
It's a crash cut. So this is, we call the face mask. We can be able to start with this one. If the oxygen is a bit low, others we call them nasoprons. It's only that we are going to put on your nasoneas. And then if you find that, despite that, your oxygen saturation is still becoming low, we'll be able to, what we call the nanometer mask. This is going to give you higher concentration up to a maximum of 15. And then if you find that we are still not doing well, we have to be able to do what we call the blood gas analysis. We are going to test that blood and then you see how the oxygen level in your blood. If you find that it is low, we are now going to think, we are going now to ventilate you. And this one, sometimes you find you are going to, we call it non-invasive ventilation.
What is low? When you say we are going to find your oxygen is low now, when you are going to use this?
Yes. We consider the hypoxia, the normal PO2 is supposed to be 80 to 100.
Yeah.
When it is now becoming 60, 50, 70, we find this patient there. And also the patient clinically is not improving, gasping, gasp for air. We now decide we can be able to support the patient. We call it an invasive ventilation. So this one, we already put in your mouth and nose, and then we set the machine according to the saturation and also the patient condition, and then after that we titrate. If despite giving you this on the ventilator, this is called a ventilator, if you find that this patient is still not improving, we are going now to put you on a monitor now. This monitor is still monitoring you, and we are now going to think of how to intubate now. Intubation is just only putting the air. This is the air. Remember, it is, as you can be able to see, I have removed my cast as well. Emergency drugs. This is, you don't waste time, because remember we call it time is tissue.
Time is tissue.
So this is emergency drug, other drugs, airway. So here I'm only going to come and pick the airway. This is the tube you are going to be put in your throat. How do you do it? How do you do it? You are going to be able to have this one. We call it a laryngoscope, and then after that we connect it. See now, it's only that I'm going to go in, the patient to see your epiglottis, and I'm aiming at trachea. Through the mouth. Then I'm aiming to see the vocal cords, and then I'm aiming to go to the trachea. With the pipe, we used to call it with the pipe. Then after that, this one, I'm going to put it inside, and then after that, I connect it to the machine, and then we continue monitoring. Remember always, these things, whenever you use them, you need also to sanitize. Always remember, after every procedure, you need always to be able to clean them for the next use. So that, because remember, you don't want to infect any other patient with the instrument you are using in the hospital. How do you prevent it? Already remember there is a recovery period, and when you go to the community, remember, how do you say? Hand hygiene is key. Hand hygiene is key. Eat well. Stop smoking. Stop taking a lot of alcohol, and don't stay in a crowded area.
So if you want to know what to eat, kindly, there's a video we've done with a nutritionist on the kind of diet to feed on when you are having this kind of conditions. And please seek the right medical advice, not from the quacks, but from the right professionals, and you'll be good to go. To any nurse who is doing critical care, to any nurse who is aspiring to do critical care, it's an intense thing. Your instincts must be very alert.
Yes.
It's not for the lousy workers. It's not for the people who are not self-pushing. I always explain that. It's something, as you can see, time is tissue. If it's an emergency drugs you've been asked for, pull it out, give the drug, withdraw the right dose, and you must have this knowledge. So today you find yourself in the Ministry of Health speaking about nurses or bringing something to the health sector about healthcare. What is this one thing that you want addressed?
I think the one thing I would like to address is the safety of the nurse. The safety of the nurse. And you see, nursing is a profession like any other professions, and people, the government should also be able to respect that. It's a profession like another profession. So whenever nurses cry for their issues, they need to be addressed as soon as possible. Because remember, the nurses are the one who stays with the patient more hours than even the doctors. And remember, they are the ones with the patient. They can also be able to know when the patients are changing. Especially for the critical care nurses. Actually, they do a lot of intervention to be able to prevent the patient from dying, and also the prolongation of the life. After they make so many interventions in comparison with other disciplines. So I think the nurses need to be respected, and whenever they ask for something, maybe for their dues, they need to be considered.
Consider, if you are from the Ministry of Health, you are from Nursing Council, you are not from the Kenya National Union of Nurses, if you are from the Kenya Professional no, not KPDU, the Kenya Professional Nurses something, there is that union. Kindly sit down and highlight this issue so that a nurse works in a very good environment. Thank you for walking with us through this journey, and I'm promising that next time the guest speaker who is gonna come here is time bomb. Subscribe, share, like, comment. Let's move. Thank you, and God bless you.